So what the advice is to reduce the inflammation at all costs and to feed normally. So let me break those two parts apart. Reducing the inflammation would look like rest, ice, and maybe even NSAIDs, so non-steroidal anti-inflammatories, so like ibuprofen. Tylenol is good for pain. Tylenol is not an anti-inflammatory, and Tylenol will not do anything for inflammation. So if we're going to choose something, we would want to choose something like ibuprofen if that's okay for you and your particular body. This is not medical advice. This is just like from the Academy of Breastfeeding Medicine. It's one of the things that they say. If you don't want to take a pharmaceutical, you could maybe look into something like the leafy tincture that is a high-dose ginger and turmeric, and it also has some anti-inflammatory effect. But one of my very favorite ways to reduce inflammation is in that sort of way. Besides the therapeutic or the lymphatic massage, like we spoke about with engorgement, you can totally do that, but also using contrast hydrotherapy.